So let's begin with our lecture, Non-Allergic Rhinitis and Nasal Polypi. In the first two sections, we will talk mainly about different types of non-allergic rhinitis. And the first type we will begin with is the vasomotor rhinitis. In this section, we will discuss the pathogenesis of vasomotor rhinitis, how the vasomotor rhinitis present itself, what are the signs and symptoms of the vasomotor rhinitis, and what's the different treatment options available for vasomotor rhinitis. So pathogenesis, like pathology is the abnormality and genesis is the development and formation. So how this abnormality develops and what are the different steps that leads to the development of non-allergic type of rhinitis, and one of which is the vasomotor rhinitis. So vasomotor rhinitis is a non-allergic type of rhinitis. So all the allergy tests, all are negative in this vasomotor rhinitis because it's the non-allergic type of rhinitis. And then usually it simulates the same nasal allergies, signs and symptoms, presentations. Features are too much similar to the allergic rhinitis, but it's non-allergic. It's classified as a non-allergic rhinitis because the pathogenesis that leads to the development of this rhinitis is different than the allergic type of rhinitis. If you see in this, this is the normal healthy mucosa, nasal mucosa, it's pinkish color, and this is when the rhinitis occurs, it causes redness and congestion and stuffiness. So all these changes occur associated with the rhinitis or inflammation. Now, the symptoms of vasomotor rhinitis are the nasal obstruction. As with the allergic rhinitis, nasal obstruction is common because with any type of inflammation, whether it's non-allergic or allergic, the symptoms which are produced are because of the swelling of the nasal mucosa that becomes edematous and it causes obstruction. And there is increased production of mucus from that. So the main changes that occur are the same, but the main difference lies in the causative agents and how they lead to the development of rhinitis. So nasal obstruction, as with any allergic rhinitis, it's same. Causes nasal obstruction because of edematous nasal mucosa and that stuffiness and congestion. So nasal obstruction is one of the symptoms. Then rhinorrhea. Rhea is the flow. Rhino is for the nose. There is excessive production of nasal secretions that keeps on coming out because of the production of mucus from the swollen edematous nasal mucosa. So another first nasal obstruction, then rhinorrhea. Both are very, very common in allergic rhinitis also. That's why it's mentioned that it simulates nasal allergy. So nasal obstruction, then the rhinorrhea. Sneezing is also common in the vasomotor rhinitis. Then the pathogenesis of vasomotor rhinitis is the nasal vasculature is similar to erectile tissue. Erectile tissue has the tendency to become enlarged, swollen, erectile, and that's the same ability is in the nasal vasculature or nasal structure. sympathetic and parasympathetic stimulation. So vasomotor, there is stimulation of sympathetic and parasympathetic nervous system. Sympathetic is known as the system associated with fight or flight response. The person is very agitative, heartbeat is fast, the blood pressure is raised, person is anxious, panic. So all these are the changes that are because of the sympathetic nervous system, as compared to sympathetic. When the parasympathetic nervous system is activated, it causes the relaxation of the person and calms down the person. So usually patients who have problems like anxiety and panic disorders, their sympathetic nervous system is very hyperactive, so they feel agitated all the time. But parasympathetic nervous system is not stimulated, so to bring the calmness back or to relax the patient. And that constant feeling of anxiety and tension and agitation causes these problems. So here, because as the name shows, vasomotor, it has to do with the vessels and the vascular system. So sympathetic and parasympathetic stimulation occurs. Then excessive secretion if overactive parasympathetic. So if the parasympathetic system is overactive as compared to sympathetic, there is excessive secretions and there is rhinorrhea. Emotions play a role also in the development of vasomotor rhinitis. In this, there is unstable ANS or autonomic nervous system. So the autonomic nervous system is also unstable. Hyperreactive mucosa responds to non-specific stimuli. There are not specific stimuli as we saw in the allergic rhinitis, when we know that it is due to dust, it's due to different allergens, pollens, mites, all those, but the stimuli are non-specific here in the vasomotor or non-allergic type of rhinitis. These are some important features in the pathogenesis of the vasomotor rhinitis: stimulation of sympathetic and parasympathetic. The autonomic nervous system is unstable. There is, if the parasympathetic system is hyperactive as compared to sympathetic, there is excessive secretions from the mucosa, and there is mucosal hyperactivity, and it responds to non-specific stimuli. So these are the steps in the pathogenesis of the vasomotor rhinitis, where the sympathetic, parasympathetic nervous system along with the emotions play an important role in the development of the vasomotor rhinitis. Now, some signs and symptoms of vasomotor rhinitis, or how it presents. We have the signs and symptoms. Again, we should know the difference between signs and symptoms. Signs, what the doctor can see or examine. Symptoms are what the patient tells the doctor. So symptoms are what the patient tells the doctor, what the patient comes to see the doctor for because they have some symptoms. And then signs, when the doctor examines the patient, that's what they see. So congested, when they examine, there is congestion and hypertrophic mucosa. So the lining of the nasal nose or nasal cavity, they are congested, there is redness, swelling, and hypertrophy. Symptoms are Paroxysmal sneezing, patient present with the sneezing. They have a paroxysmal attack of sneezing. They comes and becomes severe, goes off. Paroxysmal. There is rhinorrhea, excessive secretion from the nose, and nasal obstruction. And there is post-nasal drip. Post means back, behind, and post-nasal drip. Patient feels that there is something going back of the nose into the mouth. They feel that dripping in the mouth that tastes weird, and the patient's feelings are not very easy with that. They keep on taste something that goes back in the mouth. So that's the post-nasal drip, goes from the nose back into the mouth. So all these signs and symptoms, if you notice, they are pretty much the same as in allergic rhinitis. And later on, when we will talk about other types of non-allergic rhinitis, the main features, how it presents, are the same, because the pathogenesis and what's occurring inside the nose is almost the same. There is nasal mucosa swelling, excessive secretion from the nasal mucosa, and that causes the stuffiness, crustiness, and there is obstruction and rhinorrhea, and there is sneezing. So these are all the signs and symptoms which are common in different types. Now, the complications of vasomotor rhinitis, polyps develop. Polyps are very common complications of patients who keeps on getting different types of rhinitis because of the swelling of the mucosa. When they become edematous, they sometimes hang out and they form the polyps. And patients who are regular patients in the OPDs in different hospitals, you keep on seeing the patients who develop these polyps as a result of the allergies. So nasal polyps is a common complication, and even when you remove them, they keep on coming back. So nasal polyps. Hypertrophic rhinitis. Hypertrophy occurs, there is increase in the growth of the cells, there is thickness of mucosal lining. So that's hypertrophic rhinitis, it becomes hypertrophic. And the other is sinusitis. Sinuses are empty spaces filled with the air. Different sinuses, we have frontal sinus, ethmoid sinuses, maxillary sinuses. So all these sinuses, when they become inflamed or infection occurs causing sinusitis, is a common complication of the vasomotor and different other types of rhinitis. Treatment is, it can be medical treatment. Medical treatment include avoid the factors which leads to the symptoms or leads to the vasomotor rhinitis. Antihistaminics and oral nasal decongestants, topical steroids, systemic steroids, tranquilizers. Then surgical treatment is reducing size of the turbinates, neurectomy, and removal of polyps and DNS, deviated nasal septum. So surgery is mainly due to if it is because of DNS or the polyps develop as a result of the complication, then they should be removed, and then neurectomy, and then reduction in the size of the turbinates. That's the surgical management of vasomotor rhinitis. And as with any other rhinitis, even allergic rhinitis, the treatment is as antihistamines give the relief, Then steroids are very effective in the treatment of rhinitis, and then tranquilizers are also effective. They can calm the patient, especially when emotional type of rhinitis is present. So all these are the different treatment options for the vasomotor rhinitis. So that was all about vasomotor rhinitis. Thank you for watching sqadia.com.